to your patient. So obviously you will explain the procedure to your patient and provide the relevant nursing care appropriate. The important thing is that you put the appropriate size mask onto the patient. The mask should sit at the tip of the nose from the top of the mask, and the bottom of the mask should just sit just at the kind of point of your chin. It should not be going into the mouth, and it should not be covering the eyes. Your mask is ill-fitting and is too big if that's the case, and you may need to go down a smaller size or find a different type of device if you're at the smallest size. This area here is just a little pad which sits on the forehead for comfort. So obviously you explain it to your patient. Your patient will already be on oxygen, so we'll just take this is Tom, and we'll take it off Tom. Now, what we do is that you make sure you fit the straps correctly. And the fitting of the mask is very important, and the sealing of it to ensure that you achieve the appropriate treatment when you're trying to administer the PEEP through the PEEP valve. This would be a 2-nurse procedure to make sure that the mask is fitted correctly. So we lift the patient forward, and it sits quite snug on the patient's head. The top strap is quite flexible compared to the bottom one, so you know that it snugs the top of the head quite comfortably, and the bottom one is around the back of the neck. So you're not going to cause any restriction or pressure damage when the mask is applied. The second step is that you place your mask on appropriately, and together you will feed the straps into the mask. And together you will pull the mask. You can do it lightly at the start because it can be difficult, and then you can tighten it and adjust it afterwards. But it's important to both do it at the same time. So pull. As this mannequin has quite a small head, it's very different when it is on an actual patient. But it's very important to ensure when you're fitting your mask that your mask is not in the eyes and is not in the mouth. It's got a good seal around, and that your blue connectors on each side of the bottom of the mask are equally divided each side. If you have it in this position, which means it is shorter on one side than the other, your mask is going to be ill-fitting and you will have a leak, and your patient will not achieve the target PEEP which you are aiming to get. So it's very important, and it is a 2-nurse procedure. So you make sure it's quite well connected. This is your PEEP valve. On your PEEP valve, there are numbers, and to achieve the number which is recommended by the doctor looking after the patient, you twist the valve. So if we want to give 10, which is just here, you keep twisting until you get 10. A very important point of this, though, is when we get back to checking our manometer. So you have got your 10 set on your PEEP valve, but to clearly identify if your patient is achieving 10, you have your tubing connected from your mask over to your external CPAP at the bottom. And on the exhalation, when your patient is breathing, they should be achieving 10 of PEEP on their exhalation. And that will clearly identify and confirm that your patient is achieving a PEEP of 10. So now that we have our patient connected to our CPAP circuit, they are receiving their oxygen. It is very important that we ensure that our humidified circuit is switched on and it's not forgotten about. So to turn on your humidifier, make sure it is plugged in at the back, and you hit the on button and it will alarm. The humidifier circuit has a silence button. It's got a little diagram here which helps you identify if there is a temperature issue, where the issue is in regards to your humidifier and to the circuit. So this is the humidifier picture, and the lungs indicate the tubing and connection towards your patient. The on-off button, and also the temperature gauge, which is in the middle. The button here to the right of the humidifier is one which can be changed from a high temperature for the use for CPAP or the use for a trachea or for an ET tube, or to a low temperature for a mask. We want our temperature at a low temperature because we are applying external CPAP via a mask. If we were to troubleshoot our CPAP and our humidified circuit and it was to alarm, this picture will help you identify where the problem is, and we will demonstrate the noise that it can make. So if you hear this noise, you can see down here it is flashing at one of the side connectors, and I've just removed the blue connector. So to resolve this, we will connect it back up. This noise could occur at any of the points where your temperature management is occurring in your tubing, both at the side, at the top of your humidifier, and also towards the patient. Another option you can use your external CPAP machine for is that you can administer oxygen at a high flow. And this could be used when your patient needs a break from their CPAP mask. So how to do that is that you disconnect your patient from their CPAP mask and you explain to them, obviously, what we're going to do. And it's quite useful for meal times or just for breaks for pressure relieving purposes. So if your patient is able, you can ask them to hold your mask for you. Otherwise, you could always put them on a non-rebreathe or put them on an ordinary nasoprongs for the time being. When we take our mask off the patient, you can disconnect your circuit. So what you're doing is that your external CPAP circuit, which has your CPAP end, you're going to disconnect the part which is connected to your mask and the part with the PEEP valve on it. So then all you're left with, you can sit that away from your patient or on the side. All you're doing then is using the blue tubing and you're providing a humidified connection and circuit of oxygen only. You can administer it via a mask, or you can use nasal prongs, which are specifically fitted for the blue tubing and are available from the intensive care unit. They're similar to regular nasal prongs, however, they just are a little bit thicker. They have a more flexible tubing and a wider end which connects onto the bottom of the blue tubing. There is also a little tie for around your patient's neck for comfort. Otherwise, if you would like to use a mask, you can just use your ordinary mask, which is available on all the wards. And remember, your blue tubing, it is the connection which still has the temperature probe on, because we are administering it through a humidified circuit, so we need to monitor the temperature. And you pop it on your patient just like so. And it's quite comfortable. Once again, it is important that you make sure your humidifier is set at your temperature for your face mask. Because as I said, it continuously defaults back to your tube, so keep your finger pressed down and it'll go onto your face mask. And it'll provide comfort yet humidified oxygen for your patient. As you are not going to be using your manometer, there is no need to be worried about that. However, because we are administering oxygen and we're administering a flow, you will continue to titrate your oxygen percentage, and the flow, which is the speed at which you're delivering your oxygen through your circuit to your patient, by twisting and rotating the two appropriate knobs on the side.